A long overdue coronavirus relief package is now on the way to President Trump's desk for his signature, and it could mean money in Americans' pockets very soon. It comes as a new strain of the virus is in the UK, causing worldwide concern. ABC's Faith Abube is in Washington with the latest.
This morning, fears a mutated and potentially highly contagious version of the coronavirus is already here in the U.S. after being first discovered in the United Kingdom.
When we start to look for it, we're going to find it.
The UK waking up to a new round of strict lockdowns while leaders scramble to contain the new COVID strain.
We took prompt and decisive action.
Prime Minister Boris Johnson saying the new variant is more contagious and leads to more severe illness. But scientists around the world not yet in agreement, including the head of the U.S. operation to fight the virus.
I think scientifically, to date, there is no hard evidence that this virus is actually more transmissible.
More than 40 countries now banning travel to and from the UK. But so far, the U.S. isn't one of them. This as the nation sees its worst month yet of the pandemic, averaging more than 2,600 deaths a day. Monday, a new daily hospitalization record. More than 115,300 people fighting the disease in hospital beds.
When you get up to the ICU, you feel like you're almost getting into like a war zone.
Meanwhile, millions sliding into poverty as the virus bludgeons the economy. Overnight, both the House and Senate passing a much-needed nearly $900 billion relief package. The bill, attached to a massive government spending bill, includes $300 in weekly federal unemployment benefits and $600 in direct payments to individual Americans, billions of dollars to distribute vaccines and save cash-strapped businesses.
I personally think it's long past due. $600 isn't going to help a lot of the average Americans just trying to get by.
Well, President Trump is expected to sign the bill quickly. Meanwhile, Treasury Secretary Steve Mnuchin says that the first checks could get to those in need as soon as next week. And when it comes to the new strain of the coronavirus, one of the questions lots of people are asking is whether it'll be resistant to vaccines. Well, scientists say that's not very likely. Both U.S. and UK health experts have said that they don't expect the new strain to have an impact on vaccines. It's because the shots induce broad responses in the immune system. The CEO of BioNTech, the company that worked with Pfizer to produce the vaccine, said that this morning he is confident the shots will work against the new strain because of its similarity to other strains. They're running tests just to make sure, and will know the results in a couple weeks. And COVID-19 vaccinations begin this morning for the staff at North Kansas City Hospital. KBC10's Martin Augustine is there live. Martin, good morning to you. Now, how many shots are going out today?
Well, the hope from the hospital is to have 700 medical staff and employees vaccinated here by tomorrow night and to have everybody who works here vaccinated by the first part of the year. But vaccination number one, well, that happened this morning shortly after 6 o'clock. Becky Hoffman is the head emergency room nurse. She was patient number one today, took that shot in her right shoulder. She was happy to do it. She was confident in this vaccine. She has no qualms about it. She wants others to get the shot as soon as it's available to them, because once everybody gets immunized or many more people get immunized, then we're much farther down the road in tackling COVID-19. That doesn't mean, however, that this is just the beginning of the end for what has been a difficult year.
It's worry, like you're really emotionally drained every day because you worry about your patients and how are they going to survive? Are they going to make it off of the ventilator? Those types of things. It's really personal for each of us.
Now, the immunization that she received was the Pfizer vaccine, and that's what everybody's receiving here at North Kansas City Hospital. So they do have to get a booster shot after a few weeks, and getting everybody vaccinated here is dependent a little bit upon the supply of that vaccine as well. Reporting live, Martin Augustine, KBC 9 News.
Martin, thank you so much. Meanwhile, the first vials of Moderna's coronavirus vaccine have arrived in the Kansas City metro. The Judson County and Lawrence Douglas County health departments have received their first shipments yesterday. And the Kansas City's VA Medical Center and Wyandotte County Health Department expect their first doses this week. In its first shipment, Moderna sent out nearly 6 million doses to more than 3,700 locations in all 50 states. Nearly 3 million doses of the Pfizer vaccine have been distributed so far, with more than 600,000 shots given out. As vaccines continue to make their way to the metro, doctors with the University of Kansas Health System are addressing who will get the shots first. Staff who have the highest degree of exposure to the virus are getting vaccinated before anyone else at the health system. Doctors say as more doses become available, that hierarchy may change.
We are all in this together. It is not I the one, it is we the people. And only if we take care of we the people will we be able to successfully combat this virus.
Now, the doctors say over the next year, everyone in the general population will likely get vaccinated if they want. By this time next year, they say we should be in, quote, good shape. Well, essential workers and adults over 75 should be the priority in the next round of vaccine distribution. A CDC advisory committee voted on that over the weekend. They're calling it Phase 1B. Phase 1C will likely include people over 65, people with pre-existing conditions, and other essential workers. And it's also still unclear when kids can get the vaccine. Dr. Anthony Fauci says pediatric vaccine trials could start as early as January. If all goes well, kids would be able to receive doses within a couple of months. And as we wait for vaccines to be approved for kids, pediatric COVID-19 cases are rising. The American Academy of Pediatrics says they have gone up 25% over the past 2 weeks. And so far, more than 1.8 million children under 17 years old have tested positive for coronavirus. The AAP says that number is probably underestimated because not all states report data the same way. Children getting severely sick or dying from COVID is still rare, but experts say that they still have more to learn about long-term effects. And right now, coronavirus cases on both sides of the state line are going down. In Missouri, the 7-day rolling average of daily new cases is down to 3,100. In Kansas, 4,100 new cases have been added since Friday. The monthly positivity rate is down to 14.2% in Kansas. The positivity rate in Missouri is staying around 17.3%. And KMBC9 News is investigating a disturbing trend amid the pandemic. Elder abuse is going unreported until it's too late. In Missouri, calls to the Elder Abuse Hotline have dropped by 6% since last year. But that's not good because calls were increasing steadily for years. On the flip side, elder neglect attorney Rachel Stahl says that the pandemic has more people calling her office.
Since loved ones can't go into the nursing home, we're getting very, very sad calls. A lot of times they don't know until their loved one's been sent to the hospital. And then they finally are able to see them in the hospital.
Experts say that if you have someone older you love, make extra calls to them or someone taking care of them. Also ask open-ended questions about their health and ask if they're having trouble with their finances to make sure they are not getting scammed. 8:41, of course, 2020 has been a long year for everyone. And Kansas City Mayor Quinton Lucas compares this year to 1968. It's another time of turmoil in the city and the country. Lucas reflected on the challenging year in an exclusive interview with KMBC. He says that lifting the curfew over the summer helped de-escalate the rising racial tensions following the death of George Floyd. He also defended the COVID-19 shutdown. He thinks the local virus numbers would have been worse without it.
You know, I wish if we could do it all over again, I wish we would have had mask requirements sooner. I think that could have mitigated some of the spread and it might have led to some different approaches.
The mayor's biggest disappointment this year is the record number of murders. He said one day over the summer that the killings, the pandemic, and the racial tension stopped him in his tracks and left him wondering how we could do better.